Hey friends, Dr. Motley here, and today, part 2 of Hashimoto's and hypothyroidism. We're going to talk to you about the nutrients that you need to help strengthen your thyroid, and also the things that you can avoid to help strengthen the thyroid. So many patients come in, and if they are taking a medication like T3 or T4 to help their cells create energy, I also advise that they take certain nutrients to help alongside the medications to help rebuild the body. Now, let's go back. T4 and T3 are thyroid hormones. The body creates T4, and T4 is then converted to T3 through the action of the liver. And the liver and the small intestine have a lot to do with converting, because even the gut bacteria in your body, the probiotics, help convert T4 to T3. T4 signals your cells to create slow energy. T3 signals your cell to create quick energy. That's what we need in this age. We're moving fast. What helps the conversion? Selenium. Selenium is one of the main minerals that you would need to help that conversion. Usually 50 micrograms to about 100 micrograms. Also, iodine. Iodine is very important because it helps to make the components of your T4 and T3. However, there's some controversy. Iodine can be sometimes very agitating to the body. If you are sensitive to iodine, you need to find an iodine source that works well with you. So some patients will take iodine and sometimes they'll get a rash around their throat. They'll feel foggy-headed because it's too much of an impact on their thyroid. So I always tell the patient, let's try a liquid form. Let's try a different company. But I always find that pure encapsulation's iodine works really well. Usually has about 225 micrograms of iodine. So I say start slow. If you start with one pill, skip a couple of days. On the third or fourth day, try another. And if it helps you build energy, you know you're on the right track. Now, I also suggest different minerals like chromium or manganese, magnesium, certain herbals like ginseng or forskolin. But many times that gets overwhelming to somebody who wants to help rebuild their thyroid and go, I don't want to take all these pills because I'm already stressed out. So there's a few that I would suggest on the post and on my website. I do love Thyroid Synergy by Designs for Health. There's also Thyroid Complex, Thyroid Support Complex by Pure Encapsulation, and another one called BMR by Integrative Therapeutics, and a really good one called Thyroid Number 2 by NutraWest. I don't get any kickback, guys. I just want to let you know these brands, these combinations of supplementation are already mixed in within these supplements, and I found that these have worked really well with patients who are already on the T3 and T4. Now, if you want to prevent yourself from having thyroid issues, start taking these. Ask the advice of your primary care physician if this is something for you, because this is what happens. Sometimes, if you're on the high level or the low level of normal within your thyroid hormones, individuals will come in with symptoms. They'll feel the symptoms of having a low thyroid. The, itchy skin, dry skin, brittle hair, and brittle nails. But their doctor says, hey, you don't have any problems. You're in the normal range. But if you look at your blood work and you're on the high range or the low within the normal, it's a good idea to ask your doctor, is it okay for me to take these supplements to help rebuild the thyroid tissue? That is something you can add in to help with thyroid support. Now, what are the things that you need to avoid? You need to avoid high amounts of sugar. You need to avoid things such as bad fats or trans fats. You need to avoid gluten, dairy, and sometimes corn. Why? They have shown that gluten or gliadin, the proteins within the wheat things that you eat, the breads, the baked goods, they can actually circulate and attach to the thyroid and mimic the thyroid tissue, and your body will go in and attack it, almost like autoimmune. And that's why many thyroid experts say do not do gluten. So I advise no dairy, no gluten or breads, and if you can, avoid the corn. Those are 3 main things you should avoid. Also, what are some healthy things that you should avoid? Ask your doctor about the cruciferous plants like kale or broccoli or even cauliflower. Why? Because they have certain components with them that can actually slow down the effect of the thyroid if you eat it raw. That's why many experts say steam them up. Break down those small particles that your thyroid doesn't get injured. I say always stick with good green leafy vegetables. Eat some good fats, good almonds, good avocado, good fish oils. Avoid sugars. Guys, high amounts of sugar. Eat complex carbs like sweet potatoes or pumpkin. Those are the things, the simple things that I've seen my patients heal really well with thyroid. Also, acupuncture. Find a good acupuncturist. One that can treat the triple warmer or the pericardial meridians, strengthen the chi, strengthen the energy that goes through the thyroid, the adrenals, and the reproductive organs. You can actually learn some good acupressure points too, like triple warmer 23, triple warmer 1. Those are just simple things, but remember, find a good acupuncturist. Now, overall, I want to say this: you can help rebuild your thyroid tissue. These are just some simple examples of what I've advised my patients, what you can take, what you can avoid, and what type of practitioner that you can find to help you heal the thyroid. Remember, it's about healing from the inside out. If you are starving for energy, try these simple steps or ask your primary care physician, is this the pathway you want to go? Anyway, guys, I hope this helps. I hope you have a fantastic day. And if you have any questions, shout out to me. I'll try to get back to them. Thyroid part number 2. Let's heal the thyroid. Take it easy.